Diastasis recti is a super common condition that happens when females get pregnant. It's basically the separation of the right and the left side of the rectus abdominis, which is the six-pack muscle on the front of the body. And there's a connective tissue that lies in between the right and the left sides of that muscle. That connective tissue, called the linea alba, splits to make room for the baby when your abdomen grows. After you give birth, those two sides of the muscle can come back together and that linea alba can heal, but sometimes it doesn't come all the way back together and there's still a little bit of a gap. That's what diastasis recti is. It's usually not very painful for most women unless you're doing things like heavy lifting or intense core exercises. And usually with those, you can see a coning or a doming in the abdomen. I'll place a picture here of what it looks like. How can you tell if you have diastasis recti? So it's very simple. So you just need to take your two fingers and be very gentle, but place them above your belly button, just above your belly button, and be very gentle and just touch your abdomen right there. If you feel like a soft or jelly-like feeling, or you feel one side of the muscle and the other side of the muscle and there's a gap between that, you might have diastasis recti. But of course, consult a healthcare professional first if you're unsure or if you have pain with any of this. Let's talk about what we should try to avoid with diastasis recti. So try to avoid any heavy lifting, anything heavier than your baby. Try to avoid any type of plank motion, any type of crunching motion, any type of flexion motion that uses mostly your rectus abdominis. Try to avoid those for now. Right now, your goal is to work on your deep core muscles, to work on your pelvic floor, to work on your breathing in order to restore your core foundation at the basics, at the most foundational level. If you want to know which exercises you can start doing while you have diastasis recti, I would recommend that you take a look at my other videos about core stability. I go over pelvic floor muscle activation, deep core muscle activation in the abdominal cavity, as well as proper breathing techniques with the diaphragm. I would really recommend that you go over these foundational techniques before doing any other core exercises, because this lays the foundation for core stability, right? You don't want to start working on the superficial muscles of the core before working on the deepest layer. Like, you don't want to start building your house if you don't have a strong foundation to build it on. But in case you don't get a chance to look at those videos, I'm going to leave a list here of the exercises that I recommend.